Welcome. My name is David Stern. I'm a professor of medicine and medical education at Mount Sinai Medical School in New York City, formerly the director of global health at University of Michigan and president of an organization called the Institute for International Medical Education. It is my honor and privilege to moderate this session, and delighted that you guys found your way over to what I think is the nicest of the three venues that I've seen so far. This is a little bit more intimate. It's not warmer, that's for sure. But maybe when more people come in, it will get that way. This is, in my view, a most exciting opportunity for us to think about ways that we can use educational technology to enhance our work in global health. And I'm going to give just a very quick overview, sort of outline and queue up our speakers today, talking about where this comes from. This is obviously review for the people who are deeply in global health, but for those people like me who come from more of an education world, we have to argue to our deans that engaging in global health is something that's worthwhile for the institution to do. So I often start by reminding people about the Millennium Development Goals that we are heading to address. Those include the child mortality, the maternal health goals, and combating HIV, AIDS, malaria, and other diseases. As you know, this is this week's data, the stuff that's been released in the MDG conference. This is an example of one of the scorecards. This is Honduras, one of the great success stories of the Millennium Development Goals. As you can see, Honduras doing incredibly well, despite the absence of bubble graphs. For those of you who were listening, when was that? Is that yesterday morning? The running bubble graphs from yesterday. Honduras doing incredibly well, and other places, again, like the Democratic Republic of Congo, where things are not going so well. It is our role to see what we can do to try and improve these things along the way. And there are a variety of ways that North American universities have responded to global health challenges. I'm going to outline the framework for this and then tell you exactly what we're focusing on here today. Obviously, there has been a lot of effort in developing cures and vaccines for a variety of diseases, addressing both acute infectious diseases, chronic diseases, toxic ingestions, and various things like that. Systems of care, policies, working on all of those things. You've heard about us talk about that today and yesterday, but we're not going to talk much about it in this session. Also, North American universities, a lot of places, and you've seen this, there's some discussion of mission care, but more discussions and a lot of posters, at least that I saw, about standing clinics and efforts that have been underway. Again, these are not things that we're going to talk about in this session today. Today we're really going to be talking about education, teaching new leaders, whether those are leaders from our own institutions, Fogarty-type programs where we work with colleagues in other countries to train them, and most exciting, I think, is in situ education, that is helping enhance the educational programs in developing countries. So that's really the educational side is what we're talking about really today. There's Bill Gates talking with someone at University of KwaZulu-Natal. Workforce capacity development is really at the core of this. Most of us are in that area because it is sustainable. It is a local delivery of educational programs. It limits brain drain by avoiding bringing people here. It's also at the core mission of what we do as academic healthcare centers. The tripartite mission of most academic medical centers, healthcare centers, is research, education, and clinical care. The direct delivery of clinical care in these environments is rarely sustainable. Research we've talked about a lot. Again, what we'll focus on here is some of the sustainable efforts around education. In workforce capacity development, you can do it in a variety of ways. You can prepare our students to become better global health leaders, and you'll hear a little bit today about online education and some GHEC training modules that work to enhance our ability to work in developing countries, that is U.S. or North American-based students to do it. Some programs send our faculty to those locations. as a full-time faculty commitment. Again, that's an area of workforce capacity development we're not going to talk about. That's the model that's used by Cornell and Qatar, and better yet, probably Indiana in Moi in Kenya. But we'll also talk about leveraging existing faculty. That is, given that we know, and there was some data presented on Sunday night by Fitzmullen about the scarcity of faculty in developing countries and the growing scarcity as I read the numbers quickly coming off of that survey, 30% out-migration and 15% retirement of the existing low numbers of faculty in developing countries. We really need to do what we can to help existing faculty in developing countries provide more access to educational materials and provide them with tools to extend their teaching capacity. And we'll hear about those things today. So with that as a backdrop, we're going to hear from four outstanding speakers plus me. I don't put myself in that category. First, we'll hear from Glenn Nordin from Midwestern University, Illinois, Chicago College of Osteopathic Medicine about some information technology innovations for the GHEC modules to make them more vibrant, more alive, more interactive. I will talk about open educational resources for health, a general overview really of that idea and movement. Richard Adanu from the University of Ghana will talk about the implementation of open educational resources and e-learning in Ghana. We're privileged to have him here today. Mary Lee, provost from Tufts University, will talk about a very well-developed and organized movement by an entire institution, Tufts University, in expanding educational materials and educational infrastructure to developing countries. And then Erica Frank from the University of British Columbia will talk about Health Services Online, which is an online tool, started as an online tool to allow people access to really high-quality educational materials, which she's now expanding to other activities as well. So without any further comment, we'll turn the mic over to Glenn.